In today's fast-paced world, the healthcare sector is often ignored when it comes to appreciating the services put in by doctors, nurses or paramedics to make life better for patients. This recognition becomes even more important when we consider the fact that the medical fraternity in the country operates under a severe resource crunch. Witness this. There are just 0.77 beds for every 1,000 people. The doctor-patient ratio is 0.6 doctors, and for a population of 1 billion plus, there are just 13,000 hospitals.
As a country, we spend about 4.5%, about 5% of GDP on healthcare. That's not enough. We need to spend much more. But our view is that as the demand for healthcare increases and as the financing available, there is enough investment, enough money waiting, for investment in the sector. The moment there is financing for healthcare, we believe there is enough financing available to set up the capacity.
Viewed against this backdrop, it is imperative to recognize the selfless and dedicated services rendered by the medical practitioners in the country.
Health and awards in the health sector are very few. The doctors keep working, and all the time without getting recognition. Hospitals have to do their own publicity. However, a genuine patient and a genuine doctor and a genuine hospital needs to be recognized.
Taking an initiative on this front, CNBC TV 18, in partnership with ICICI Lombard, instituted the India Healthcare Awards in 2010. Recognizes and awards hospitals and doctors who are pulling all stops out to provide quality healthcare services in the country.
The India Healthcare Award, which I am really happy to see that it's aiming to raise the standard of care of healthcare that is being delivered to our people. And it does motivate particularly the providers to raise the standard in terms of what they do with the patients, how they treat the patients, and the kind of outcomes. So the Healthcare Award, some of the criteria that has been used, it's all aiming towards superior outcomes and aiming towards superior patient care.
Post the success of the first edition of the India Healthcare Awards held in 2010, the second year has seen more participation from hospitals. The India Healthcare Awards has become a prestige that every hospital wants to covet, and this time over 4,000 hospitals have registered to compete for this award, compared to 2,000 in 2010.
It's bringing a lot of enthusiasm as well as interest in hospitals in the country to compete, and indirectly it's going to help the patients a lot because hospitals are going to put a lot of effort to improve their quality of services and care.
What lends this award a very high degree of credibility is the composition of the jury panel. They are all well-known and respected names in the healthcare sector. They are Keval Handa, Managing Director, Pfizer Limited; Dr. S.K. Sareen, Director, Institute of Liver and Biliary Sciences; A. Vaidheesh, Managing Director, Johnson & Johnson Medical; Dr. Ramakant Panda, Director, Asian Heart Institute and Research Center; D.G. Shah, Secretary General, Indian Pharmaceutical Alliance. The jury had to select the winners out of the shortlisted names given by our knowledge partner IMRB. But for IMRB, this task itself was quite a challenge. They had to filter out 4,000 entries using the preset parameters. On this front, IMRB left no stones unturned.
Basically, we first asked the hospital administrators about the infrastructure. We talked to the peer group itself about the evaluations for the award. And we talked to patients to find out their levels of satisfaction. Now, if you talk to the hospital administrators, the kind of information that we sought from them was the sort of number of hospital beds that are there, the occupancy rate, the kind of number of doctors that they have by different specialities, the papers that are written by the doctors in that hospital, as well as the information that was slightly difficult to get, which was with regard to the mortality and the rate of infection in those hospitals itself.
The nominations were decided after interviews with hospital administrators for the data like infrastructure, patient safety record, innovation, and research, after which IMRB field officers personally interviewed the doctors. Here, care was taken to interview doctors who have been practicing medicine for at least 10 years. Besides, to get a 360-degree view, IMRB also conducted a survey among patients to find out their experience of the hospitals. To accomplish this task, IMRB's field officers fanned out in 17 cities covering primary, secondary, tertiary, specialty and multi-specialty hospitals. After getting inputs from 3,500 hospitals, IMRB approached 260 hospitals for more information. Thus, in all, 590 hospital administrators, 270 specialists, 340 doctors, and 2,013 patients or their relatives were interviewed. All these data and numbers were crunched by IMRB and presented to the eminent jury. The evaluation parameters were based on the quality of doctors and treatment, the staff attitude and behavior, the hospital infrastructure, the management of the hospital, the value for money, and the innovation in treatment. Picking the winner from the best is always a tough task. So how did the jury select the winners? On that note, it's time for a short commercial break. When we come back, we take you to the jury's chamber and show you how their minds work. On November 30th, the esteemed jury members came together at the Trident Hotel in Mumbai to discuss, debate and deliberate on the shortlisted names processed by IMRB. Right from the word go, the discussion was intense, even as key IMRB officials were making their presentations. The collective wisdom of the jury was very evident. Their vast experience, specialization and evaluation methods showed as they looked closely at each nominee who was shortlisted by IMRB. Their probing mind, their quest for more information, or the way they were dissecting information was indeed an enriching experience. IMRB, which had to feel through some tough questions from the jury, were also given suggestions to improve their methodology for the next year. The jury strongly felt that it was imperative for them and IMRB to have a preliminary meeting before this whole exercise begins next year. The jury also gave suggestions in the general hospital category. Here, they felt the medical colleges should be kept out and the upper limit cutoff should be 100 beds for non-metro categories. At one point during the debate, the jury wanted to scrap the general hospital category as they were not convinced with the shortlisted names, but later decided to choose the winners from a revised list. In the general hospital category, the jury felt it would be more appropriate if the finalists were approved by doctors chosen by them in a particular city to evaluate and scrutinize the shortlisted hospitals. But in certain categories, the jury felt very strongly about not giving any awards. They were Metro West Zone, Metro East Zone, Metro North Zone, Non-Metro East Zone. The jury was pleased with the inclusion of patients as it covered all dimensions of experience. With the nominees doubling from last year, the jury was extremely impressed with the effort put in by IMRB.
The jury will sit ahead of time and lay down some more criteria. For example, we said we should not look at the speciality based on revenues or based on the footfalls, but maybe just as a speciality itself and judge it. We're looking at having more people in the panel to judge the hospitals which are not in the main cities. That's the way the jury is evolving.
After nearly 3 hours of brainstorming sessions, the jury did pick up the winners for the India Healthcare Awards 2011. Coming back after the break, we give you a glimpse of the hospitals who made it into the coveted list of this prestigious award. The India Healthcare Awards jury had a tough time in choosing the winners from the shortlisted names. The jury was firm that even if the hospital is well equipped with the latest technology, it must meet the criteria under the category it has been nominated for. This clarity saw many hospitals entering the coveted list. So here are some of the nominees who made it under the various categories. In the category for the best single specialty hospital, the nominees are Cardiology, Christian Medical College and Hospital, Vellore; Narayan Rudalaya, Bangalore; Fortis Heart Institute and Research Centre, Delhi; Asian Heart Institute, Mumbai; All India Institute of Medical Sciences, Delhi; B.M. Birla Heart Research Centre, Kolkata; Sri Jayadeva Institute of Cardiovascular Sciences and Research, Bangalore; Manipal Heart Foundation, Bangalore; Apollo Hospital, Delhi; Fortis Hospital and Heart Institute, Bangalore; Gastroenterology, All India Institute of Medical Sciences, Delhi; Asian Institute of Gastroenterology, Hyderabad; Christian Medical College and Hospital, Vellore; Sanjay Gandhi Postgraduate Institute of Medical Science, Lucknow; PGI, Chandigarh; Jaslok Hospital, Mumbai; Asian Hospital, Chennai; Global Liver and Gastroenterology Centre, Bhopal; Medinova Hospital, Hyderabad. Gynecology, St. Mary Maternity Hospital, Bangalore; Apollo Hospital, Delhi; Gunashila Surgical and Maternity Hospital, Bangalore; Siddhi Vinayak Maternity and General Hospital, Mumbai; All India Institute of Medical Sciences, Delhi; Pulse Women's Hospital, Ahmedabad; Sri Lakshmi Clinic and Maternity Centre, Chennai; Mayflower Women's Hospital, Ahmedabad; Sanjay Memorial Hospital, Delhi; Breach Candy Hospital, Mumbai. Nephrology, Institute of Kidney Diseases and Research Centre, Ahmedabad; Karnataka Nephrology and Transplant Institute, Bangalore; Apex Kidney Care, Mumbai; Hyderabad Kidney and Laparoscopic Centre, Hyderabad; Bangalore Kidney Foundation, Bangalore; Gujarat Kidney Foundation, Ahmedabad; Fortis Hospital and Kidney Institute, Kolkata; RG Stone Urological Research Institute, Delhi; Kidney Line Kidney Hospital, Ahmedabad; BKF Chande Nephro Urology Centre, Bangalore. Neurology, All India Institute of Medical Sciences, Delhi; Christian Medical College and Hospital, Vellore; National Institute of Mental Health and Neurosciences, Bangalore; PGI, Chandigarh; Ramachandra Hospital, Chennai; Institute of Neurosciences, Kolkata; Sri Chitra Hospital, Tiruvananthapuram; Advanced Neurology and Super Specialty Hospital, Jaipur; Criticare Super Specialty and Scan Centre, Mumbai; Narayana Institute of Neurosciences, Bangalore. Oncology, Tata Memorial Cancer Hospital, Mumbai; All India Institute of Medical Sciences, Delhi; Adyar PM Hospital and Research Centre, Chennai; Apollo Cancer Hospital, Chennai; Kidwai Memorial Institute of Oncology, Bangalore; Rajiv Gandhi Cancer Institute and Research Centre, Delhi; PGI, Chandigarh; Indo-American Cancer Institute, Hyderabad; MP Shah Cancer Hospital, Ahmedabad; Bangalore Institute of Oncology, Bangalore. Ophthalmology, Arvind Eye Hospital, Madurai; Shankara Netralaya Medical Research Foundation, Chennai; Indian Institute of Ophthalmology, Delhi; LV Prasad Eye Institute, Hyderabad; Agarwal Eye Institute, Chennai; Aditya Jyot Eye Hospital, Mumbai; the Eye Research Foundation, Chennai; Divya Prabha Eye Hospital, Trivandrum; Bhakti Patel Eye Hospital, Ahmedabad; Bhubaneswar Eye Institute, Bhubaneswar; Calcutta Lions Netra Niketan, Kolkata. Orthopedic, Fortis Bone and Joint Hospital, Mumbai; Orthonova Hospital, Delhi; Orthonova Hospital, Mumbai; BM Orthopedic Hospital, Chennai; All India Institute of Medical Sciences, Delhi; Soundarapandyan Bone and Joint Hospital, Chennai; Christudis Orthopedic Specialty Hospital, Chennai; Ganga Hospital, Coimbatore; PGI, Chandigarh; Parex Hospital, Ahmedabad. Pediatric, All India Institute of Medical Sciences, Delhi; Christian Medical College and Hospital, Vellore; PGI, Chandigarh; Apollo Hospital, Chennai; the Kanchi Kamkoti Child Trust Hospital, Chennai; Kalavati Saran Bal Hospital, Delhi; Surya Nursing Home for Children, Mumbai; Rainbow Hospitals, Hyderabad; PT Hinduja Hospital, Mumbai; Chaitanya Hospital, Chandigarh. Multi-specialty hospitals are hospitals that specialize in more than one category. The nominees are Metro Hospitals, Bombay Hospital and Medical Research Centre, Mumbai, Nair Hospital, Mumbai, JJ Hospital, Mumbai, Lokmanya Tilak Hospital, Mumbai, Dr. Balabhai Nanavati Hospital, Mumbai, Dr. L.H. Hiranandani Hospital, Mumbai, Saifi Hospital, Mumbai, Apollo Hospitals, Chennai, Sri Ramachandra Medical College and Research, Chennai, Bilroth Hospital Limited, Chennai, Max Healthcare Institute, Delhi, Fortis Malar, Chennai, All India Institute of Medical Sciences, Delhi. Non-metro hospitals. The nominees are KK Hospital, Lucknow, Christian Medical College and Hospital, Vellore, SUM Hospital, Bhubaneswar, Apollo Jubilee Hills, Hyderabad, SK Soni Hospital, Jaipur, Kalinga Hospital, Bhubaneswar, Fortis Escorts Hospital, Jaipur, Care Hospital, Hyderabad, High Tech Medical College and Hospital, Bhubaneswar, Apollo Hospital, Ludhiana. General hospitals are those which provide both general medical and surgical, but limited with regards to specialist access. The nominees here are Metro West Zone, Kambala Hill Hospital and Heart Institute, Mumbai, Guru Nanak Hospital and Research Centre, Mumbai, Prince Ali Khan Hospital, Mumbai, Rajawati Hospital, Mumbai, Thane Civil Hospital, Mumbai. Metro East Zone. The nominees are Amri Hospital, Kolkata, Calcutta National Medical College and Hospital, Kolkata, Park Clinic, Kolkata, Health Point Hospital, Kolkata, North City Hospital and Neuro Institute, Kolkata. Metro North Zone. The nominees are MGS Hospital, Delhi, Lions Hospital and Research Centre, Delhi, Shanti Mukund Hospital, Delhi, Akash Hospital, Delhi, Deepak Memorial Hospital, Delhi. Metro South Zone. The nominees are Lifeline Hospital, Chennai, Sridevi Hospital, Chennai, Sugam Hospital, Chennai, Wisdom Hospital, Chennai, AV Hospital, Chennai. Non-Metro West Zone. The nominees are Shrey Hospital and Research Centre, Ahmedabad, Maharaja Yashwant Rao Hospital, Indore, Ruby Hall Clinic, Pune, Inlax and Budaravi Hospital, Pune, Anand Hospital and Research Centre, Indore, Bhandari Hospital, Indore, SN Goyal Hospital, Indore, Ankur Hospital, Indore, Pawar Surgical Hospital, Pune, Dev Hospital, Ahmedabad. Non-Metro East Zone. The nominees are Capital Hospital, Bhubaneswar, Vivekanand Medical Mission, Bhubaneswar, Bhubaneswar Municipal Hospital, Bhubaneswar, Dr. Ruba Memorial Hospital, Patna, Annapurna Memorial Hospital, Bhubaneswar, Jeevak Hospital, Patna, Shri Shri Borda, Bhubaneswar, Shyamal Hospital, Patna, Anup Memorial Hospital, Patna, Amritash Hospital, Patna. Non-Metro South Zone. The nominees are Krishna Institute of Medical Sciences, Hyderabad, Medwin Hospital, Hyderabad, Hosmat Hospital, Bangalore, KG Hospital and Postgraduate Medical Institute, Coimbatore, PRS Hospital, Trivandrum, Agadi Hospital, Bangalore, GEM Hospital and Research Centre, Coimbatore, Sri Kumaran Hospital, Coimbatore, Credence Hospital, Trivandrum, Madhava Nursing Home, Hyderabad. Non-Metro North Zone. The nominees are IB Hospital, Chandigarh, Government Medical College and Hospital, Chandigarh, Saket Medicare and Research Centre, Jaipur, Dayanand Medical College and Hospital, Ludhiana, Deep Hospital and Research Centre, Jaipur, Awadh Hospital, Lucknow, Ayush Hospital, Jaipur, City Hospital and Trauma Centre, Lucknow, Ajanta Hospital and IVF Centre, Lucknow, Metro Hospital, Jaipur. Well, with so many names to choose from, who will be the winner? Catch the winners of the India Healthcare Awards 2011 at a glittering function at Taj Palace, Delhi next week.